All right, so generally people around the house tell me to quieten down, so just let me know if that's the case up the back. So, yeah, thanks for having me, everyone. Thanks for organising such a great event, the Freemasons Centre and Peacock and the PCFA. So I've got a lot of first-hand experience with prostate cancer. That's my grandpa. He died at Door Park Hospice, as I used to say, in nappies. And my dad also had prostate cancer about 8 years ago, so I'm in the box seat for it. But luckily, 14 years ago, I got into men's health physio, bit of a different path. But I do lots of sports physio too, and there's lots of parallels, just like lots of you guys have played sport too. All men affected by prostate cancer are unique, so I don't really take anything for granted when I'm looking at guys going through their prostate cancer journey. Just because you're 80 doesn't mean you're not sexually active. Just because you're 65 doesn't mean you're continent. Okay, I meet lots of guys who've never talked about leaking until they've come and seen me. Mild incontinence to one person might be severe to another. So I've got guys that aren't really bothered by the fact that they're leaking half a litre of urine into their undies on a daily basis, but then other guys are worried because they're leaking 20 grams per day. So just like with sporting injuries, a hamstring tear to someone isn't a hamstring tear to another. Injuring your hamstring the week before a grand final is devastating. But for some people, even if you rupture an Achilles, like I did 8 weeks ago, it's not really the end of the world when you put everything in perspective. With my guys, education is key. So I use lots of sporting analogies, and the reality is failing to prepare is preparing to fail. I use lots of things like pre-season is preparing you for your football season, like your pre-surgery workup, or your education is preparing you how to tackle your cancer journey. You guys really need to be empowered with the choice as to what decisions you make. I can't fix most people that come in, but I can guide you and hopefully give you some really good advice to help make sure that you maximise your outcome. So knowing your plumbing is really important. So this picture is a little bit full on for most guys. There's lots of squiggly lines, but you've got your bladder, your prostate, and your urethra. I like to keep things pretty simple because us men are simple. This describes things a lot better. You've got a big elastic rainwater tank, okay? So it expands, and the muscular walls of your bladder contract to push out the wee. When you want to wee, you turn the tap open and out it comes down through the hose, your urethra. Now your prostate sits just down around here. But unfortunately, when you have your prostate cancer surgery, or sometimes during other treatments, it stuffs up your tap, makes it rusty, sometimes takes off a bit of your tap. And so the tank just becomes buggered. Sometimes it can heal up, but it doesn't always work that way. So, the consequences of radical prostatectomy or for prostate cancer treatment. The big ones are urinary incontinence and erectile dysfunction, which most guys come to me to seek advice and help for. What I reinforce to most guys is that we can't forget these are the side effects of a potential cure for your cancer. Okay, and it's very easy for guys to forget that when the cancer's come and gone down the track. But I do remind them that this was a possibility. So what do we know can affect the outcomes? There's a lot that we can't control. Your age, unfortunately, the older you are, the more likely you are to have poorer outcomes if you're having radical prostatectomy. The surgery itself, you're in the hands of the good urologist for that. Things like the size of the prostate, how much blood is lost, whether it's a nerve-sparing operation, the experience of the surgeon. But we know there's a few things that can be changed which might help your outcome. Pre-op continence and erectile status. If you've got issues before your operation, try and see if you can do something to improve it in that 4 to 6 weeks you've got beforehand. Pelvic floor exercises. We can get you working them before your operation or before treatment. BMI and body weight. Most guys, including myself, can stand to lose a few, but I guarantee that a bit of extra fat around the tummy doesn't help your bladder fill. Your level of physical activity, your smoking status, alcohol consumption, these are all things that can have a bit of a negative effect on your outcomes afterwards. So try and see if you can change them before the operation. If not, definitely afterwards. Physio is not just about pelvic floor exercises, and pelvic floor exercises are what everyone wants to get started with as soon as we start. But I tell guys, it's all about that rainwater tank. You've got to understand the rainwater tank. It's one thing to try and get the pelvic floor exercises working, but we also got to go through a bit of other education and make sure you're doing the right things outside of the exercises. But everyone wants to go off with pelvic floor exercises first, so I'll start with that. So lots of you guys in the room would know, it's not a finger up the bum. Okay, that was a long time ago that took place. We're much better off with technology now. Yes, some people can learn from YouTube, okay? Just like some people from YouTube can learn how to play golf, okay? But it's really hard to tell if you're doing it correctly, but we can definitely tell if you're doing it wrong without using the ultrasound. But ultrasound in the clinic is really the best way for us to tell if you're doing it right. The next step guys always ask is, how many sets and reps should I be doing? They've always Googled and it says 10 reps of 10 seconds. Well, that's like me saying to a runner, this is what you're going to do for fitness. I want you to run 5 laps in 90 seconds and repeat that on every 90 seconds. It just doesn't work. You can't have set recipes for everyone because everyone is different. So how long is a piece of string is what I tell people who want to know how much exercise they should be doing. So yes, your pelvic floor unfortunately doesn't fix everything, okay? So some people will still leak. Often I see people down the track who have been doing their pelvic floor okay, but they haven't necessarily been trying to practice doing it in a challenging setting. So we try and get them in the gym doing their exercises like Holly will talk about in challenging ways that means that they're going to build up tolerance. You need to try and make your pelvic floor kick in a little bit more automatically than what it did before your operation so that it can support and hold off from the intra-abdominal pressure that makes you leak. It's like football players. It's one thing for them to be good at kicking goals from 30 metres straight in front, but you don't very often kick goals from 30 metres straight in front. You've got to kick them from the boundary. You've got to learn how to do snapshots. You've also got to be able to do all the other things, running, tackling, etc. And the same with golfers. You don't just putt, you don't just drive. You've got to learn everything in between if you want to be effective with what you're doing. So you've done your pelvic floor exercises and you're still leaking. So yes, some things to train your bladder. Guys are really good at getting in bad habits. Yes, I still chew my nails, okay? But going just in case, trying to have little strategies which will reduce leakage often lead to bad habits which don't help you fill your bladder down the track. Now, most guys will essentially improve with their continence over time, but in the first few months, they just want to take shortcuts. We all do. Okay, because you think you're doing what is the right thing. Sometimes you just got to suck it up a little bit and just make sure you're doing what you're told and know, again, after the education, why you're doing what you're trying to achieve. So, yes, getting in good habits is really important. And again, that's very individual for people. It might be not drinking a litre of Coke in the middle of the day, which some guys do. It hasn't been an issue until they've had their prostate out. Body weight, again, I touched on that before. Excessive body weight will never help. So getting in some healthy habits, exercising, the right diet, the right food, and the right fluid diet is really important for improving that. There's a few other little things that we can do which might help in certain instances too. I've had lots of guys coming in telling me about how they hold off the tip of their penis to stop themselves urinating, but I'd say to them, what happens when you need to urinate and you're at the shops? Do you just walk out holding the tip of your penis? And that's what things like clamps are for, okay? I've had other people come in saying they've used rubber bands, and I said, there's better ways of doing things these days. It's not cheap, but I guarantee you it's a lot safer. So, yeah, penile clamps sometimes we'll use. Eurodymes, sometimes I'll recommend people to look into things like that. And these are all other little devices which I call enablers. You don't have to use them all the time, but they might enable you to go and play golf, go do something that's a little bit more strenuous than what you might be able to do, which will stop you leaking as much and help improve that quality of life without you having to worry about leaking through to your pants as much if you've got heavy leakage. I'm really big on some of the washable continence undies too. So I'll name drop Moddy Body because I think they're pretty good, they're pretty cheap, and they're pretty fashionable. But most brands these days actually, if you look online, will have some kind of continence option, which is washable. Often they won't hold a hell of a lot. I'm talking about, maybe 40 to 50 grams, but it's a great option for guys so they don't have to use quite as many pads, and also can end up being quite cost efficient if you're not really using a lot of pads. And the other option is that it makes you feel, again, a little bit more normal, like you're not having to wear your big pull-up nappies that some guys have to wear. Other things that guys have that we can try for leakage, the chair. I've had lots of people call up and quiz me about the chair for electrical stimulation of the pelvic floor muscles. I've only had one client that used it. There's not really much scientific evidence to justify it at all. That client had a bit of money and said they were quite happy to waste their money on it, which I think they did in the end. But again, it's just an expensive option for people to try. I've also had people call up and inquire about things like shockwave therapy. Again, there's not a lot of research for it. I don't do it myself, which is, if more research came out for it, I'd probably support it, but I can't justify it at the moment. Erectile function or lack thereof. So, lots of questions coming through before the presentation about erectile function. I'm more than happy to answer some questions afterwards. There's huge variability in rates of erectile dysfunction after the surgery. But I tell everyone that I see before the operation, have a farewell party for your mate before they go overseas. If your mate comes back after their little sojourn, happy days. You can have another beer with them, okay? But lots of guys take a long time to get their erectile function back. Some guys, a week after the catheter comes out, no problems, but there's few and far between that are like that. So really, when we talk about what can you do to help it, it's all the same factors we talked about before that you're going to use to improve your erectile function, including being more on top of your cardiovascular fitness, again, that Holly will go on and talk about. So really, for erectile function, I tell guys, you need to modify your expectations around sex until you know how things are functioning. Intercourse and intimacy might be a little bit different. You might have a little bit of urine leakage, okay? When you're a 21-year-old, you don't really think about that. But yes, when you're 80 and you've had prostate surgery, sometimes it happens. So set yourself up for success and not for disappointment. So it doesn't matter so much if you're having a bit of a fondle with your partner in the shower and you leak a bit of urine, whereas if you're in the bed and you don't have any towels down or anything and you're halfway through and you've got a bit of spillage, what do? You panic. So set yourself up for success. In terms of setting yourself up for success, the other things are medications. Now, most of the urologists these days are very onto the medications. The early implementation of tablets, and sometimes the injections as things go on as well. So most guys do go down this path, and I guarantee you that most guys are very apprehensive about using injections until they do it, and then they love it, and then they want to keep doing it if they're really chasing good erectile function, this is. Some people are more than happy just to let things go because they're at an age where it's no longer important, but for some people it's really important. Pumps and rings. Again, the people at the sex shops love you guys. They see you walk in the door and they know exactly what's going on, and they see dollar signs because they know that you're going to be an easy sell for a pump or some penis rings or some other toys and paraphernalia, as I call it. Okay, they're really good with this stuff, and I'd really encourage all guys that want to pursue erectile functions, go and have a chat with your sex shop, and if you're not too sure who are the good ones, then yeah, you can hunt around or let me know. Lots of guys haven't used condoms for a long time, but if you get a bit of leakage, condoms can help prevent a bit of embarrassment and a bit of leakage. And the timing and location. As I mentioned before, in a shower can become a little bit of a favourite pastime for some people. The timing, try and empty your bladder beforehand though. That's one time when I'll give guys a little bit of slack in terms of going just in case. Also, really important, lots of guys tend to wait until their leakage is better before they try and focus on their erectile function, when really lots of the treatment is focused on both at the same time. So don't leave it too long to start focusing. Start early and be patient, because it can take a very long time. So exercise is medicine. I love exercise because I did sports science degree before doing physio. I'm going to leave that pass over to Holly for that. But your pelvic floor works when you move and when you exercise. When you do exercises for the pelvic floor, this isn't the first time your pelvic floor muscles have ever worked. They've been working your whole life. You've just never had to focus on using them. So motion is lotion. If not for your own improvements in continence and erectile function, do it for the other health and mental benefits as well.